Another episode of Ask the Doctors on Whitewater Community Television. That's WGTV Channel 11, WCTV Channel 21, and streaming live on Facebook. If you have a question, ask it on WCTV's Facebook page, or you can send us a tweet at WCTV Info. Also, I want to thank John Pawsey and the staff at CTV3 in Connorsville for airing this episode. I'm your host, Dave Jetmore, Wayne County Health Officer. I'm sitting in once again for Eric Marsh, our normal host. Hopefully Eric will return next week. With me today is, in his customary seat to my left, is Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health. And to my right, Christine Stinson, Executive Director of the Wayne County Health Department. Good afternoon.
Good afternoon.
Thanks for being here. It would be lonely without you. Why don't we start in our usual manner in this pandemic by going to Dr. Huth and having him kind of give us an update on where we are with this pandemic in the world and in the United States.
Right, of course. Actually, the U.S. has been in a decline of cases, and I don't know, Stephen, if you're able to pull up that graphic that I sent along. If you do, fine. If not, that's fine too. But we've been in a decline in the U.S. for several weeks now. Actually, the biggest contributor to cases in the world right now is India at about 60,000 cases a day. The U.S. is down to about 40 to 45,000 a day. Hopefully that trend will continue for us, but I worry a little bit about India because of its relative lack of infrastructure and resources compared to the U.S. But we'll just have to see what happens with that. They may be plateauing. In Indiana, we've had kind of a plateau of cases over the last few weeks. That it may be down a bit from last week. Hopefully that's the start of a trend in the right direction. Deaths have continued to be kind of low, about 15 a day on average. And that's in marked contrast to the spring when we had lots of deaths in the state. At the same time, we were having lots of cases. And now we have a situation where there are lots of cases, but many fewer deaths. And as we've talked about before, I think a lot of that has to do with the better job we're doing of safeguarding the people most at risk is probably the number one effect. But now with the increases cases, that is in lower age groups. And in Wayne County, we've had an increase in cases over the last few weeks, but in last week and this week, we've actually had a slight downtrend. I don't know, when I say this week, I mean last week ending last Saturday. Right. I'm not sure where we're at this week, and Christine can probably say if we're still on that track or not. But you know, we've had a bump, and at Reed, we had actually last Thursday, Friday, had gotten up to 7 COVID cases on ventilators, which is as much as we've had for a couple of months. But now that's back down to kind of our customary 1 to 2. That's much better. And we'd like to see it be 0 more consistently. In fact, it was 0 today. Okay. 0 ventilator patients, and that's really good. And you know, we talk about statistics as numbers, and you know, people involved in medicine can sometimes kind of look at the job very kind of coldly and distantly in terms of numbers and so forth. But the reality is these are people, real people, suffering the effects of this illness, and we'd like to see the whole thing go away. But if we have to have cases, we want to see few severe cases and few deaths. Now, I know that the county has had a few deaths, a couple deaths over the last few weeks, and that's certainly not a trend we want to see continuing. But overall, things are not so bad. Now, I can say this, in the counties surrounding us, particularly 2 in Ohio, Preble County and Darke County, they've had a lot of increase in cases, particularly associated with nursing homes. In fact, both those counties are on the top 10 list of the most severely affected on a per capita basis counties in Ohio. The Ohio governor is doing twice a week news conferences, and last week started showing a list of cases per 100,000 in Mercer County, which is north of Darke County, then Darke County, and this week Preble County is perked into the top 4. So many of these newer cases are associated with long-term care facilities, which is not a good place at all to have cases, because those individuals are highly at risk, the residents of those facilities. And in fact, they had, I think it was in the paper, they had something like 38 patients or residents of the facilities affected, in addition to 18 or so staff. That was as of a couple days ago.
And I think 11 of those people were hospitalized.
Yeah, and they've had a number of hospitalizations, so trending towards the more severely impacted, and that's worrisome. And we're
well, obviously, these infections in these nursing homes were brought in because these people are basically socially isolated. They're not traveling.
So true. They has to come in somehow. It's riding on somebody, and when you think about the situations that exist in nursing homes today, virtually all of them are still pretty locked down. When you go to one of those places and you're met at the door by somebody that's screening you for symptoms and taking your temperature, and they've cut back on the numbers of people who have access to the facility, and the residents themselves are typically separated from other residents and do most of their activities in their own rooms and so forth. So when it comes to the residents, working with the residents, and when I go there, I see the staff doing a very good job of wearing their masks and hand hygiene and so forth. Question is, how is it getting there? Well, I think the problem can be that what you do with the residents is sort of one layer, the innermost layer of a onion or concentric circles. The next layer out is, what are the staff doing when they're not actually patient-facing, when they're in nurses' stations, they're in break rooms, and so forth. And what I sometimes see is they've got their masks off, they're huddled close together, and they're laughing and talking out loud and so forth. And so taking steps to avoid, if somebody comes in and it's positive in the break room, they're going to spread it to other people if they're not continuing the safety precautions. The third layer around that is what the staff do outside the facility in their private lives. I think what people have in working in that environment have to realize is that they're responsible for that too. They can never lay this burden down. They can never forget it entirely and just be a normal person. They've got to take care of themselves and avoid situations where they may come into contact. And that's what I do. I would like to do things that I'm not doing now, but I do that because I need to go into those kinds of environments, and so I feel it's my duty to avoid getting to situations where I can accidentally pick up the virus and then accidentally transmit it to other staff and residents.
Christine, have we had any really bad outbreaks in nursing homes since the pandemic started here in Wayne County?
No, our long-term care facilities have had intermittent cases among staff and residents, but we've never seen a widespread spread throughout the whole entire facility. And I think that goes to some of the things that Dr. Huth talks about, and I've talked about just what a monumental job it is for the directors and the staff at these long-term care facilities to be diligent every single day to protect their residents. And it's a responsibility that I know that they all take seriously. We're in close communication with our long-term care facilities. If they need something, we're kind of the radar for them. We'll go out and scavenge for it, whether it's they're having trouble getting shipments in of PPE for their staff. We'll make sure that we get it through the Strategic National Stockpile and get them what they need until their shipment can get in there. But it is a concern. Anytime we get a case reported to us in a long-term care facility, we're waiting for it to happen, because it can happen like that, and it's devastating.
What's happened as far as COVID goes, and I don't know if anybody has their pulse on what's happening in Wayne County more than you do, Christine. What's happened this past week? in terms of testing numbers, positive
Yeah.
cases?
We test regularly. We have at the OptumServe site, and that's the only one I know that I can watch routinely on that one. But our numbers are fairly steady there, between 150 and 270 a day. Mondays are always our big testing day at the OptumServe site. Up to 270, 279 on Mondays we routinely do. And then throughout the rest of the week, it's somewhere between 150 and 200 that we do.
It's a long stretch. At the beginning, you remember we were having 20 or 30 cases a day, and we were pleading with people to get tested so they wouldn't take the testing side away.
Yeah. So our test is very, very successful. So much so that they put 2 teams in there, so to handle that amount that's going in there. Some of the things that we're working on, the county took the testing grant through ISDH, so the local health department will take over the community testing, and it will be at the Elder Beerman site. So
And
now
when will you take that over, Christine?
We'll take that over September 1.
All right.
But that doesn't mean OptumServe is going away. I've been working really, really diligently with the state to find out what does that mean. You know, where does that put OptumServe, because they do a tremendous job at testing.
Yes, they do.
But Richmond has several testing sites. So Richmond has the OptumServe site available. They have First Care that does testing, both the PCR testing and rapid testing. Reed does testing through their respiratory care clinic, and then also CVS has picked up to do testing. So, and that's on the Chester Boulevard CVS. Not all of the CVS do them. So Richmond has a lot of testing available. What I would like to see is us push some testing to some of the outlying, and I think that in that Centerville, Hagerstown area would be a good place to, since the county will take over the testing at the Elder Beerman site, if we could find a facility in that Centerville, Hagerstown area to take the OptumServe site and put them out there for our outlying community, that they don't have to come all the way to Richmond for that, because Richmond is definitely a city on the eastern side of the county, and it kind of leaves the western side of our county barren with services. So
Cambridge City comes to mind. It's way out on the west side of the county.
yeah. So we're working on that, hopefully to get that, but it'll be something that kind of like the OptumServe site was at the beginning, where we're trying to get people to realize that there's a service there. So you'll see a lot of information come out if we can make that a reality.
Okay, well, thank you. Let's see if we'll ask Steve if we've got any questions from Facebook or Twitter. We do. Last I heard, Reed's COVID capacity was at about 50%, which is good compared to where it was in April. But how does this translate to numbers? How many COVID patients is 50% capacity?
I can't say as I know as we sit here exactly how many COVID patients we can have, because we actually can expand and contract those areas, and we have contracted them over time. So what percentage of the Reed capacity we're filling today, I don't know. We have, however, about 25 cases in isolation today, which we've had as many as 70 some. That number is probably the least, not the best indicator of total COVID, because it's an admixture of situations. More important is the laboratory positive cases, and that was at, I think, 12 today, which is actually down. And when we were at our height in April, we had probably around 25 or so. So I guess maybe, to finish the thought on that, I mentioned already that the ventilator case, we didn't have any this morning, which is down from 7 last week, so that's been a little variable.
What's
over
our
the last
total
week.
ventilator capacity?
Oh gosh, I think if you pulled in all the devices that could be sort of co-opted for use, like we're talking about OR ventilation systems and stuff like that, I think we could handle upwards of 60 to 80 patients, kind of depending on how extreme you wanted to get with what devices we wanted to pull in.
So we've got
We're
vast
far from
reserves in that
Yeah,
department.
we have plenty of reserves. And if you look at the state's website, I think it's been consistently showing that about 80% of the state's capacity for ventilators is still available.
Yeah.
Did you answer the question, Tom?
What the percent of capacity?
What, how many patients? It sounds like we've got at our maximum we had 75 patients,
Yeah.
and currently we have 25. So
About a third.
let's call it 75. I never bother not answering a question just because I don't know it, Tom. You got to be more.
Well, I usually talk around it and hope that it kind of sounds like an answer. But I think if you said, what's the maximum we could handle today, I'm sure it would be 2 to 3 times what we currently have.
All right.
So let's call it 30%.
Good one. Okay.
I like that.
I like that answer too. Moving along, do we have another question, Steve? How many workers in the Reed Health Group have had the virus?
Wow, that's a great question. I wish I knew the answer exactly. And I suppose you have to define your terms a little bit. I'm sure there are plenty of people have had the virus,
Right.
It's not a negligible number, because, for instance, I'm aware of people who definitely got it in the community and stuff like that. And you're
Well, I
probably
guess the
contact
question is,
tracing a number of
who all is in the Reed Health Group? Does that mean people working in outlying offices and practices that are relying with
basically,
Reed?
Reed has somewhere around 3,500 employees. So if you wanted to say, amongst all the Reed Health employees, 3,500-ish people, how many have had the virus or currently have it? I don't know what that percentage could possibly be. We wouldn't probably even know exactly. Now, if you're meaning to ask how many got it in association with work activities, there are people who've gotten sick from coworkers, or especially early on. Mm-hmm. There were a couple of small outbreaks. Somebody came in, having gotten in the community, working in an area that's not patient-facing, like in departments. There are a number of departments that don't patient-face. We're talking about information technology, the medical records area, business office areas, and so forth. There have been several small outbreaks in those kinds of areas from one coworker to another. Now we're much better about the discipline with masking and so forth, and those kinds of outbreaks are fewer and farther between. As far as who's gotten it occupationally, working with patients, early on there were 1 or 2 like that when we were first starting getting patients, and people had inadvertent exposures as before we had our systems ramped up. But that's been
months ago.
It's been a long
cases
time.
that I remember. They were, and also when the epidemic began, I don't think, at the very early, the first patients we saw, nobody even suspected COVID.
Right, exactly.
So there were no precautions on the part of the healthcare workers, and it was a very small number. But I can't think of anyone in recent times that has had a hospital-related or clinically related infection that they caught in that circumstance.
I think we feel really good about the PPE, that when it's used properly, consistently, it's very protective. Probably, and there haven't been very many changes in the PPE recommendations from the CDC lately. Probably the last one was that if a patient is unable to wear a mask, a COVID patient's unable to wear a mask, then the caregivers who are working with them should not only wear a mask, but also eye protection. That's been probably 6 weeks ago that came out. But, I think there's a lot of confidence in the PPE policies and procedures, and we monitor the symptoms, and we're quick to test
And because of what
anybody.
you're saying, I think I think early on people were reluctant to come to the hospital for conditions because they thought, they're treating COVID patients there. We could become infected. It's risky, but that's proven not to be the case. And people should come to the hospital. If you need the hospital, go there and get treated. You'll be safe. Do we have another question, Steve? Have there been any reported cases of reinfection in Wayne County?
I'm not aware of any. You might be.
That's an interesting question. We've known of people that have had long durations
Yes.
of the illness, and there's been talk of, was that a reinfection, but we don't think that it was. So I do not know of any reinfection.
Well, I think some of the problem that happens here is you have somebody, they develop COVID, they're tested, they're positive. They're isolated for 10 days, their symptoms disappear, their fever goes down, and then they get retested and the test is positive. I think that what happens, the test is so sensitive, it's measuring broken virus particles, if you will, little pieces of RNA of the virus, but they're not infectious. The patients, their test is positive in that instance. It's picking up some viral material, but that viral material is not infectious. So I think early on many people thought, well, they've gotten reinfected, when in fact that wasn't the case. I think the current thinking is people do not get reinfected, and that you have immunity for at least a period of 6 to 8 weeks at the minimum.
Yeah, I think the open question is how long that can last, and there could be people who have say very minor symptoms, and maybe they don't mount that much of a antibody response, and maybe they don't have that strong of immunity going forward. There are many unanswered questions around all of this, but I think that the CDC basically has some level of confidence that if you have a significant case of COVID, you are not likely to be able to be reinfected within about 90 days,
Yeah.
because a lot of the guidance is built around that. Like, say, for instance, if you have somebody that was a known COVID patient who's identified later in a contact tracing as a close contact, and my understanding is you do not retest them, you do not isolate
Right.
them, as long as it's within the 90 days of when they had their illness.
That's correct, and we're navigating our way through that as schools have started to open up. We've had cases where a student is identified as a close contact. However, 3 weeks ago, they were a known COVID patient. So that 14-day quarantine is then waived on that person. And so that leads to confusion and the feeling of unfairness amongst some people. So we get calls, that, hey, I know that so-and-so was a close contact. Why aren't you guys making them do the 14 days? My child has to be in the 14 days. This isn't fair. There's nothing fair about this virus. It hasn't been fair from the get-go. But
why don't you take a moment, Christine, to address something that I think is confusing to a lot of people. Some people are quarantined for 14 days. Other people are isolated for 10 days.
Right.
Why don't you tell our viewers where these two numbers come from and how they're applied?
Right. That's probably the number one call that we get about, and that's people are confused over what does it mean. So when the health department is notified that someone has COVID, either they're clinically diagnosed through symptoms or they're diagnosed through a positive laboratory test, they are put into a 10-day isolation period. And the reason that we do a 10-day isolation period is because we know that they have the illness and we know how that illness progresses. And so in 10 days, so long as they've been fever-free for 24 hours and they have an improvement of their symptoms, so their symptoms have improved, they haven't had a fever for 24 hours, and 10 days has elapsed since they've started symptoms, we're confident that they can go back to their life and not be shedding the virus and infecting anyone else. Now, so for one of their close contacts, that were in close contact, so that's that 15 minutes within 6 feet of someone that
and that
has the
defines a
virus.
contact.
That is
a lot of
close
people are not
contact.
sure what a contact is. Go ahead.
Yeah, so you've been identified as a close contact of a known positive. You're then put into quarantine for 14 days. And that's because we don't know at what point you will become positive or if you'll become positive. So we're going to watch for 14 days to see if the virus develops in you. And then if it does, you go into the 10-day isolation. Mean the same thing. You come out of circulation in society. You limit the contact that you have with other people, both whether you're in isolation or quarantine. But the 14-day is so we know if you are or aren't going to develop the illness. And we know that 90% of people will develop the illness between 2 and 14 days, and that's why the 14 days is required instead of 10 days to watch to see if someone's going to develop those symptoms.
So we're not trying to play favorites here when
No.
we tell people it's either 10 or 14 days. This is just totally dictated by whether or not you had the disease or you're a contact.
Right.
We don't play favorites on these quarantines.
I never play favorites.
I know that. I know you're famous for being fair. Do we have another question, Steve? If you have had COVID-19 and tested positive for antibodies, how long does the immunity last? Well, you kind of touched on this, Dr. Huth, earlier. Why don't you elaborate?
The short answer is we don't know. The longer answer is we think it's significant. And again, the CDC thinks 90 days is kind of a minimum time frame probably. But, we don't really know. Now, I think there's an aspect to this is we can't base all of the discussion about immunity on neutralizing antibodies because we know that there are other parts to the immune system that can play a role. We've got the memory cells and the B lymphocytes and the T lymphocytes have a role in all of this. So it could be that immunity actually is a prolonged thing, or it might not be. We just don't really know. And one of the things that we'll find out with time is how long all that lasts. And that will be especially important when we get to having vaccine. If we get a vaccine, say January, February, March, and we all get vaccinated then, but the pandemic goes on for another 6 months or a year, or we're going to need to be revaccinated sometime after that.
Right.
We may well need to do that. So I think a lot of these questions are high on people's minds, and we'll be finding out as we go along.
And that's vaccines differ. If you have a vaccine for hepatitis A or for measles, you don't have to have a booster shot. You're not going to get those particular diseases for the rest of your life. You're done. Other vaccines, the antibodies wear off. If for instance, you get a tetanus shot as you're a child, and 15 years later you have a nasty foot wound, you'll probably be given what's called a booster shot in the emergency room to lift your antibodies up again so you don't get tetanus. And that may be the case with whatever vaccine we have. And it would suggest, since these antibodies trail off in so many people, that we may see that with a COVID vaccine. So yeah, I understand what you're saying.
I think that it brings, to light just how young we are in knowing this virus. Right now the CDC and everyone's comfortable saying that we have about 90 days worth of immunity, immune response in this. And then after that, we're kind of unclear. That may change. Next month we may get notice that now it's 6 months that we do. But that's because we're in a very new virus. And you talk about some of those other things that we have immunizations for. And then with COVID, there's just so much unknown that when I hear people talk about, let's just get to herd immunity, everybody get it and just get herd immunity through natural acquisition of it. I think that's a really dangerous path to take because we don't know what the lasting effects of having COVID-19. We're seeing some football players have to sit out a season because they've got some damage to their heart from COVID. So I think that that's a dangerous thing to do. when I was younger, we just had everyone just get chicken pox and no problem. Well, now my generation suffers from horrible shingles that we get when we get older if we don't take a shingles thing, and we didn't know that chickenpox virus would then cause such a severe reaction as we got older. So I just think that it's it's not the course that we should go for natural immunity in this. It's not a disease that I would want to get because I'm not sure the lasting effects it would have on me.
You bring up the whole concept of herd immunity, and this is what immunologists call having control of the disease with enough people having had the disease and having antibodies. And we've always heard that this is anywhere from 60 to 65 to 70% of people, which is a lot of people.
That's a lot.
And especially when the World Health Organization said that they would accept a vaccine that was effective in 50% of people who were vaccinated. But I read today that many epidemiologists feel that herd immunity is probably going to end up being around 50%. And the reason for this is on their earlier models, this was predicated on the fact that everybody had the same susceptibility and everybody would interact in the same way. But in later models, this has changed. And this is heartening news because if we can reach herd immunity with half of our population, that's much easier to accomplish when you're talking about millions of people than 70%. Especially with a vaccine that may only be 50% effective, and we don't know what we're going to get.
Right.
Steve, do you have another question for our group? When a vaccine becomes available, should we trust it?
Well, I would say we can trust that the Food and Drug Administration is not going to allow the release of a vaccine that hasn't been tested to their satisfaction. That's probably about as much as we can say. And let's contrast that with the situation in Russia where, they've rushed a vaccine to market, and now they're actually having trouble getting people to take it because they skipped the very important phase 3 evaluation, which is an important broad administration of a vaccine to volunteers to study safety amongst other things. So the Food and Drug Administration has said they're not going to skip that. Now they're going to shorten some of the phases. Or I've noticed for a couple of the vaccine candidates now, they're essentially combining phase 2 and phase 3, and that's another way to shorten it. Another shortening to release is they're investing in the manufacturing facilities to be able to rapidly produce it once it's approved, in particular vaccine cases. The U.S. government is investing in those facilities now so that there's not a delay after approval. So there are various ways that process is being shortened, but I don't think any of it is really going to be taken at the expense of safety, is my personal opinion. Everybody's going to have their own opinion. I can tell you that when it becomes available, if they offer it to me first, I will take it. No questions asked, but I'm not sure I'm the first person who should get it. It's not going to be 330 million doses available on day one. That's going to come out in batches, and so there's going to have to be a process to prioritize.
Vulnerable people are going to have to get this first.
Yeah,
nursing home, elderly
absolutely.
people, people with comorbidities,
And
ill
I'd be
people.
okay if you got it before I did, Dr. Jetmore, because you're 1 or 2 days older than me.
I think I'm a month older than you, Dr. Huth, but I've been ridden hard and left wet on more occasions than you, and that's the reason we look so different. But let me say something to the person that asked this question about trusting the vaccine. This is something interesting. The easy part is making the vaccine. I mean, that's pretty easy for these scientists to do, and they can do this often in a few weeks to a month. They've got a vaccine. So you have these 3 trials, and in the first trial, they give it to 50 people. Do they get violently ill? Do they throw up? Do they become blind? I mean, there's some bizarre thing that would just nip the whole thing in the bud. Okay, the 50 people are fine. Maybe they have a little bit of redness at the injection site. You can accept that. So then you have phase 2, which you give it to a group of people, say 1,000 people, and see if what happens in their blood. Are they developing antibodies to this particular virus? And then the stage 3 portion is it's given to 10,000 or more people, and they're just go about and live their lives, and we see if they become infected compared to a control group. A person asked me the other day, Christine, well, this seems kind of slipshod when they're going through all this so quickly, and it's not. It's overseen by the FDA, and a lot of the time that's been eliminated has been in between these trials. Mm-hmm. The FDA, the government is trying to grease the skids between, say, phase 1 and phase 2. There might be 2 or 3 months delay where you appeared before the FDA panel, presented your case. So I would feel very comfortable getting this, and since I am a month older than you, Dr. Huth, I would get the vaccine before you would.
Good. I'm glad you did that.
I'm glad that question came up, because those are things that are being discussed. And when we looked at Russia and how they got this, and they touted it as, just this Herculean thing that they did, who knows? They won't show any papers on this. They won't show us the clinicals on this. But when the FDA does give an approval, when we can get one, we will be able to see all of the trials. We will be able to see all of the path that it took to get to that approval. Some of the things also that's shorting this down is they're already in production of some of these before they get the approval. And they're thinking that it'll be better to waste product than waste time. And so not all of the ones that are in production now will get that approval. And how confident I am in the FDA and their approval process is my son is one of the at-risk people, and I will gladly, have him get that vaccine. That's how much I trust it, because if anyone knows me, they know how much I adore my children. And what I only want what is best for them, and I will put him in line to get that first, because I want him to stay safe, and I think the vaccine for my son is better than getting the disease for my son.
And I think what we know so far about the safety profiles of the now 4 vaccines that are starting the phase 3 trials is because phase 2 is giving it to healthy volunteers to specifically look to see what side effects are and so forth, and the side effect profile is pretty much exactly like what you get with the normal seasonal flu shot in every respect. Maybe a low-grade fever, maybe a sore arm. You mentioned some of those things, and those are typical potential side effects of the seasonal influenza vaccine, which I have never not taken in 35 years of being in this business. I've never not done it.
Yeah.
And so I have every confidence that so far the data points to this is going to be no different in that respect. The bigger question is we hope that it will be as effective as it is safe. I think that's kind of where I'm at, that I'm looking for the data on that more than the safety piece, because I think they know where that's going to be.
Well, I think we're all looking forward to a vaccine, because I think that will bring an end to the pandemic and let us have our lives back again. Steve, do we have another question? Why does the health department make some people be in quarantine for 10 days, and yet my son had to be in quarantine for 14 days? Well, this is right in your wheelhouse.
It is.
Christine, I'm going to let you handle this.
Right. Well, and that it kind of lets me talk about what the health department is doing. So this is the progression of how it happens at the State Department of Health and the local health departments. So someone gets tested and their test is positive. That gets reported into the state NBS system. And that case goes to the state case investigators. And when this first kind of started going and we saw how many cases, Indiana hired all of these case investigators. So they take the first try at that. about 60% of them get lost to follow-up in the first day, and then those get sent to local health departments to try to do. And we were finding we were unable to keep up with all of those cases. So we put a request in to have some of the CARES Act money hire 3 case investigators for Wayne County. And the commissioners did that. We've hired the 3 case investigators, and they then take the cases and work them through, and have been very, very successful at being able to contact everyone. So the people that are known positive, they have been tested or they were clinically diagnosed with that, are put into a 10-day isolation period where they are to really have no contact. We even want them away from their family to try to stop the spread, because what we see are outbreaks in the house. You know, if one person get it, there is a high probability that others in that household will. So we tell them to, you know, isolate away into your own bedroom, try to stay away from your family as much as possible. And then their close contacts, anyone that's been in that 6-foot bubble for longer than 15 minutes, we get that list and we then contact them. When we're working with the school gives us the list of who they have. That's why they have seating charts, and everyone's is in assigned seats.
So we know who those contacts are.
We know because the school tells us. I'm not going into the school and pointing out kids. The school gives me a list of who was in this person's bubble, and we contact them. They are the close contacts of a known positive. And they then are put into a 14-day quarantine, where they're watched for 14 days to see if they develop the illness. If they don't, after their 14 days, they then can return to the normal life, back into school, back into their normal activities. So that's why there's a difference in that. We know in 10 days, so long as your illnesses have had an improvement and you haven't had a fever for 24 hours, you're no longer able to shed that virus. The 14 days is because we know people can develop the illness anywhere from 2 to 14 days.
So by a cruel twist of fate, you could end up being isolated. Say you have the disease, and say you're a contact. So you're isolated for 14 days. On the 13th day, if you develop the disease, then you need to be isolated for 10 days. So you could be shut away for 23 days, which would be terrible, but necessary, and that's what's dictating why some people are asked to have different times of isolation.
Right.
And I think hopefully that'll make people feel better on what sentence they're given in isolation. Steve, do we have another question? What are the large gathering guidelines for Wayne County? What happens if they are not followed?
Oh.
I hate to give this to Christine because she may have to be tied up and gagged.
Sedated.
Sedated,
yeah,
too.
So we do have guidelines. Anyone that's having a large event must get an approval from the health department. So they submit a plan to us. First thing that they have to do is they tell us how many people are going to be at the event. They can't just say, we're going to allow however many people into the event. We look at the space of the event that they're going to have. If it's a small venue and they say they're going to have 3,000 people there, we will deny that and say reconfigure how you're going to meet, you know, the guidelines of where you're going to have 6-foot separation. So first they have to tell us how many people are going to be in the venue, how big the venue is, how they're going to keep people 6 feet apart. They have to have signage of if you're ill, stay home, the signs and symptoms of COVID-19, and a way to track who's there, so a way to contact people. So if we do have an outbreak there, the venue will give us the names of people that we can contact to see if they are experiencing symptoms, or we can alert them that there was a known COVID at the event and that they should be on the lookout for signs and symptoms of that. So the second part of the question is probably the most frustrating, of what happens if people don't And there is not a lot. There's not a lot of enforcement that was given when the governor gave us this duty to do.
I think initially there was an enforcement provision. I think it was going to be a misdemeanor or a small fine, but there was so much pushback that the governor dropped that.
You're right. Right. So, and this happened over the weekend. Very disappointing. I was very disappointed because our community as a whole has done a very good job. And when you look at Wayne County, we're sticking out like a sore thumb, and half from the get-go. We've kept our numbers low. Right now, our positivity rate is one of the lowest in the state, and one of the lowest in our district. So we're doing things correctly. We're doing things right.
Let me interject, because I think the viewers would be interested in knowing this. The 7-day average positivity rate for COVID testing in the state of Indiana is 7.7%, and the 7-day positivity rate in Wayne County is half that, 3.4%.
Right.
So go ahead.
Right, and that's not to say we don't have cases, but it's to say that we as a community are doing a good job of testing. You know, and testing is a key to being able to manage the disease, so we can do the contacts and the isolations and the quarantine. So it's important that we're testing often and a lot, which we are. We're doing a really good job on that. But then we all still have to do the other part of it. The hard part of this is doing those things that change what we normally do. Putting a mask on when we go out in public, maintaining that 6-foot separation, not attending large events, especially the ones that are not requiring the separation and the masking and those other safeguards that are put in place for those large events. So this weekend, I was, sent several pictures, from people, with their, what's going on here? Look at these pictures. And lots of people gathered together, not a mask in sight, certainly no social separation of people, everyone crammed up together. And I was very disappointed when I looked to see that one event had a plan that they just chose not to follow, and then the other one didn't even put a plan to us, for us to approve or deny. And then the most disappointing thing is there's really nothing that we can do, short of shaking our heads and asking the community to not attend events that are doing things like this, that are not promoting the social separation, not requiring the mask of people that are attending these events. Because what happens is when these get out of control and we start seeing our cases go up, and at one point we had a positivity rate of around 10%. It was a kind of a noisy time in our history, and it was not too long ago, but we were very concerned that it was going to be long term. But if we see our positivity rate going up, our cases going up, then what will happen is the health department will have to recommend, like some of the other counties have, to not have large events. And so you won't have any events larger than, at times we've had it at 10, at times we've had it at 25. We don't want to go to that.
The disheartening thing about this is that when you have a large event and you have a positive case, how do you do contact tracing?
Right.
And you're in a crowd, you don't know these people are strangers to you. You don't know how to have any kind of contact tracing. On another note, I've had people comment to me, and I'm sure you've heard this too. I was in a store, I was in a business, and nobody was wearing masks. And we can't go over there and find these people or punish them in any legal sort of way. But I would encourage all of us, to vote with your feet. I mean, don't patronize those businesses, because guess what? You're in danger when you go in there and you're dealing with a person in a cash register without a mask. That person may have COVID and not know it. 45% of people that are spreading this virus have no symptoms. Mm-hmm. So you kind of have to assume or act as if everyone you see has COVID and act accordingly. But the one thing you can do, which is punitive, is to not patronize these businesses, which are just acting as scofflaws, as just choosing not to wear masks because I don't know what their reason is, but they're...
We had people send us some photos of an establishment in Wayne County, and their sign said, you know, we don't require you to wear a mask, come on in. No mask required, and that's incorrect. Masks are required. Whether the establishment makes you wear a mask, you are mandated by the governor of Indiana to have a mask when you wear or when you're in a public space.
Oh, that's a good point. The proprietor is not given this latitude to choose whether or not it's going to be an establishment with masks. The governor's mandated that. The sign should say, even though we've been mandated to wear a mask, we choose to disregard this and want to put all of our customers at risk. That would be a more informative sign. Steve, do we have another question from our viewership? When someone has tested positive, is it true that they will continue to test positive even after symptoms have stopped?
They sure can, and the positive test can last a good number of weeks. I think the record is somewhere around 80 to 90 days. Mm-hmm. But it's pretty clear that you really can't, especially if you have active COVID disease, let's put it that way, it's pretty clear that after about 10 days of illness, the ability to transmit actual disease seems to go away. So there's a difference between testing positive and being transmissible, right. And we have to keep that in mind. And that informs the current recommendations not to do follow-up
right.
testing with people. You know, there are some, occasionally people will say, well, I want to get my employees tested again to make sure they're negative before they come back to work. The problem is that doesn't really help.
Right.
You know, they may well continue to test positive, but they're not unsafe to come back to work.
And we recommend that they don't
right.
do that. And at one point, not long ago, there was a testing recommendation to where if you tested positive, if you had 2 negative tests 24 hours apart, you could leave
right.
the 10-day isolation, and they've removed that.
Right.
So they're not confident in that testing. The 10 days they're very confident in.
Right.
Well, we're getting close to the end of our show. It went by quick. I think we have time
it's talk about some stuff.
What?
I have some stuff that I wanted to talk about.
Oh, well, we can answer this quickly. Does drinking lots of water help flush out COVID-19?
No.
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 All right.
Okay, and what do you have?
Well, the health department we had that mask giveaway that was very successful at 3 locations in Richmond.
How many masks did you give away?
Close to 300,000. So
That's
over
amazing.
266,000 masks.
That's
yeah.
incredible.
Yeah, and we had 3 sites in Richmond. We are now going to take that to the outlying areas. We're nailing it down, but I believe it's going to be September 12th, and it looks like it'll be Cambridge City, Hagerstown, and Centerville that will be doing that mask giveaway again, and all those masks are given to the community by the commissioners. So, and they have committed at least another 300,000 masks to be given away at the outlying. So look for more information on that. It will be, we're nailing that final day down, but I believe it'll be September the 12th.
And you know what's encouraging about that is not only, did the county give away those masks, but people came and got the masks, which implies that they're going to wear those masks and they're going to comply with protecting themselves and one another from the virus. So.
The last thing that I have is the health department is having a drive-through, walk-in immunization clinic on Saturday the 12th at our facility. There'll be no appointments necessary. We take most insurances. We take Medicaid. If you don't have any insurance, come and see us. We'll be able to take care of you. So it doesn't really matter.
And that'll be at the health department. And tell us the address of the health department.
The health department is 100 South 5th Street. And it'll be drive-through, so you won't be coming in. We'll take care of everything outside, and that's going to be Saturday, September the 12th, from 10 a.m. to 2 p.m.
All right, great. We're going to try one more question.
Okay.
It probably will require more than a yes or no answer, but let's see that. I have heard that coronavirus can live on certain surfaces for a period of time, but I've also heard that it's unlikely to spread in this way. Why is that?
I guess we don't know for sure. It does seem that the contact transmission is a minor, if it even plays any role. Hard to find cases where that's the source of an outbreak. But we do know that it can live on certain surfaces or be detectable on certain surfaces. Let's put it that way. Whether those viruses are so-called replication competent or not is a different question. So it's kind of an area that needs more study.
No.
Well, I think a lot of it, too, is when this first started, we thought, gosh, if we touch something, we're going to immediately get this virus. And then the epidemiologist told us that there's such a thing as an infective dose. Mm-hmm. In other words, you're much more likely to get the amount of viral particles that it takes to infect you from someone breathing into your face for in close quarters for 10 or 15 minutes than you are picking up a frequently touched surface and rubbing your eye. So that's not to say, and I think we all hasten to say this, that we should abandon hand hygiene and not continue to decontaminate frequently touched surfaces. But as you said, Dr. Huth, this has not been a big mode of spread. This is basically a virus that spread through the air from droplets and outgoing breath. As far as I remember there was a big controversy as to how long these particles would live on various surfaces. People were asking, should I order that gizmo from China, and when it comes, do I have to decontaminate it? And the answer is no. And then people did studies on what different kinds of surfaces, how long viruses could survive. I think they survive like an hour on cardboard and can last up to 3 hours on stainless steel surfaces, maybe a less period of time on copper. But no, you don't hear much about that now because we've moved on. Well, I want to thank Christine for being with us today. As always, a fantastic guest. I want to thank Dr. Huth for his contribution to the program. As always, he has so much interesting knowledge to give us. The COVID site for free COVID testing is Monday through Friday, 8 a.m. to 8 p.m., 601 East Main Street, Richmond, Indiana. You can register by visiting lhi.care/COVID testing. John Powling and his staff down at CTV3, I need to thank you as well for airing this episode. Take care of one another out there and take care of yourselves.